There's a moment I've seen again and again in my practice. An older adult sitting across from me, rubbing stiff fingers or aching knees, whispering, "Doctor, I just want to move without pain again." Arthritis steals more than comfort. It can rob independence, joy, and the simple pleasure of walking in the garden or playing with grandchildren. And when conventional medications come with side effects that feel just as frightening, people often turn toward natural remedies with hope in their hearts. One spice has captured more attention than almost any other: turmeric, that golden powder found in kitchens and ancient healing traditions for centuries. Could it hold real power against arthritis, or is it simply another myth wrapped in bright color? I'm Dr. Brian, and welcome to Channel Wellness Blueprint Over 50. Today, we're peeling back the layers of science and story to uncover the truth about turmeric and your joints. When we look closely at turmeric, the magic seems to rest in one remarkable compound: curcumin. Think of curcumin as the spark inside the golden spice, carrying anti-inflammatory and antioxidant strength. Inflammation is the fire that feeds arthritis, and curcumin acts like gentle rain, calming those flames. Antioxidants, meanwhile, are like shields protecting the joints from wear and tear caused by oxidative stress. Scientific studies have compared curcumin's effects to common over-the-counter drugs and found that, surprisingly, it can rival them in reducing inflammation and pain, yet often with fewer risks. This is why curcumin has become such a focus of hope. Imagine your joints as door hinges. When they're well-oiled, they swing freely, quietly, and without resistance. But when rust sets in, each movement grinds, squeaks, and hurts. That rust in the human body is inflammation. It is both a protector and a destroyer, meant to help us heal, but when it lingers too long, it becomes the spark that keeps arthritis burning. This is where curcumin steps onto the stage. Curcumin doesn't bulldoze through the body like some strong medications. Instead, it acts with a kind of precision, calming specific signals that tell the body to stay inflamed. Scientists have shown that curcumin can lower the activity of molecules called cytokines and enzymes like COX-2, which are notorious for fueling inflammation. You can think of cytokines as tiny messengers running through your body, shouting, "Stay inflamed." Curcumin quiets those voices, allowing the body to rest from its constant state of alert. I remember a patient named Helen in her late 60s who came to me after years of wrestling with swollen, painful hands. She told me, "I feel like every joint is on fire." Traditional medications had given her some relief, but the side effects, stomach upset, dizziness, made daily life difficult. With her permission, we discussed adding a high-quality curcumin supplement into her arthritis management plan, alongside her usual care. Within a couple of months, Helen described her mornings as less of a battle. She could button her blouse again without tears. While her arthritis wasn't cured, the inflammation seemed quieter. The fire dialed down. Science supports stories like Helen's. In several clinical trials, curcumin supplementation has led to measurable reductions in joint swelling and tenderness. One study even suggested curcumin could work as effectively as diclofenac, a common anti-inflammatory drug, for people with knee osteoarthritis, but with far fewer stomach problems. That comparison is striking because it gives older adults a potential alternative to medications that, while effective, can sometimes damage the stomach lining or kidneys over time. But it's not just about pain. Chronic inflammation, when left unchecked, gradually erodes the cartilage and tissues that protect our joints. It's as if the hinges on a door are slowly being worn away, leaving nothing but grinding metal. By calming inflammation, curcumin doesn't just ease discomfort. It may also help preserve the integrity of the joints, protecting long-term mobility and independence. Another way to picture it: inflammation is like traffic clogging up a busy street. Nothing moves smoothly, everything slows down, and accidents are more likely to happen. Curcumin acts like a skilled traffic controller, guiding those signals so the body can flow again. The relief people feel isn't just from pain reduction, it's from the body being allowed to function more normally. Still, I remind patients that curcumin is not a miracle cure. It works best as part of a holistic arthritis management plan: gentle movement, balanced nutrition, and sometimes medication when needed. But as an anti-inflammatory agent, it gives people a valuable tool, especially for those over 50 who want to reduce their reliance on strong pharmaceuticals. Every time I talk to someone about curcumin's anti-inflammatory effects, I see a spark of hope. Because inflammation is at the very heart of arthritis, calming it offers not only joint pain relief, but also a chance to reclaim freedom of movement. For someone who has felt trapped in their own body, that can feel nothing short of life-changing. If inflammation is the fire that keeps arthritis burning, then pain is the smoke that follows, spreading into every corner of life. Pain shapes the way we move, the way we sleep, even the way we think about the future. For many of my patients, pain is the loudest complaint, the part that makes them feel older than their years. And yet, what often surprises people is how deeply pain is tied to those same inflammatory pathways, and why curcumin can play a role in quieting it. Pain in arthritis doesn't appear out of nowhere. Imagine nerves as alarm wires stretched throughout your body. When inflammation builds, it presses on those wires, making them spark and send signals of distress to the brain. Curcumin, by lowering the body's inflammatory messengers, reduces the pressure on those alarm wires. The brain receives fewer urgent signals, and the lived experience is relief, sometimes gentle, sometimes profound. I think of Robert, a retired teacher in his 70s. He loved to walk every morning with his wife, but his knees ached so badly that he began staying home, sitting by the window instead. The loss of that routine weighed heavily, not just on his joints but on his spirit. When he tried a carefully chosen curcumin supplement, combined with light stretching exercises, the change was gradual but noticeable. After several weeks, he told me with a smile, "Doctor, I walked the block today, and I didn't have to stop halfway." That small victory restored more than mobility. It restored joy. Science echoes Robert's story. A study published in the Journal of Alternative and Complementary Medicine compared curcumin to ibuprofen in patients with knee osteoarthritis. The results were compelling. Both groups reported significant pain relief, but the curcumin group had fewer gastrointestinal complaints. For older adults who often worry about stomach ulcers or digestive upset from common pain medications, this finding matters greatly. It means there may be a gentler path to relief. Pain relief through curcumin isn't just about soothing the nerves directly. It also works by interrupting what's called the pain-inflammation cycle. Pain causes tension, tension worsens inflammation, and inflammation leads to more pain, a downward spiral. By calming the inflammation, curcumin interrupts the cycle, giving the body a chance to reset. Patients often describe this as a sense of lightness or less heaviness in their joints, rather than a dramatic disappearance of all pain. That subtle shift is enough to encourage movement, and movement itself becomes a medicine. There's also something deeply empowering about using a natural compound that comes from food. Many of my patients tell me they feel safer trying turmeric because it's familiar. They've seen it in the spice aisle or tasted it in curries. While supplements are stronger and more concentrated, the psychological comfort of choosing something natural often makes people more consistent in taking it, and consistency is where real benefits unfold. It's important to be realistic, of course. Not everyone experiences the same level of pain relief. For some, curcumin is a helpful companion to physical therapy and medication. For others, it provides noticeable comfort that allows them to cut back on pills. The key is patience. Unlike a fast-acting painkiller, curcumin's effects tend to build over weeks of steady use. When pain begins to ease, doors reopen. People return to gardening, to morning walks, to bending down and picking up their grandchild without wincing. The gift curcumin offers is not just arthritis pain relief, it is the restoration of possibility, the reminder that pain doesn't have to dictate the story of growing older. Arthritis is not a single enemy, it wears many disguises. For some, it's the slow wearing down of joints with age, like an old floorboard that creaks louder with each step. For others, it's the immune system turning against the body, attacking joints as if they were foreign invaders. These forms, osteoarthritis and rheumatoid arthritis, share pain and stiffness, but their roots are different. The question is, can turmeric, and more specifically curcumin, help in both cases? Let's start with osteoarthritis, the most common type, often called the wear and tear arthritis. Picture the cartilage in a knee as a soft cushion between two bones. Over the years, that cushion thins out and the bones begin to grind against each other. The friction triggers inflammation, which then fuels pain and swelling. Studies have shown that curcumin can ease this cycle by lowering inflammation markers in the joint, much like adding oil to a squeaky hinge. In one clinical trial, patients with knee osteoarthritis who took curcumin reported significant improvements in physical function and reduced pain compared to those on placebo. That means curcumin didn't just make people feel better, it allowed them to move better, climb stairs more easily, and engage in daily life with less struggle. Now consider rheumatoid arthritis, which behaves very differently. Instead of gradual wear, the immune system mistakenly wages war on healthy joint tissue. The result is swelling, tenderness, and sometimes deformity in the hands, wrists, or feet. Here, curcumin's value lies in its ability to calm the overactive immune response. Research has shown that curcumin can reduce C-reactive protein, a blood marker of inflammation that runs high in rheumatoid arthritis. Some patients report less morning stiffness, fewer swollen joints, and more flexibility when curcumin is added to their treatment plan. Of course, it doesn't replace essential immune-modulating drugs, but it acts as an ally, an extra shield that makes daily life more manageable. I once worked with a patient named Samuel in his early 60s, who was living with rheumatoid arthritis. He described mornings as the longest hour of the day when his hands felt frozen and sore. With his rheumatologist's approval, he added curcumin to his regimen. Within 2 months, he noticed the stiffness easing earlier in the morning. It wasn't a miracle cure, but it gave him back precious time each day, the ability to make breakfast without waiting in pain. For Samuel, that was no small gift. Curcumin's effectiveness is not identical for everyone, and we must acknowledge that. Some people feel dramatic relief, while others notice only a gentle improvement. The science reflects this variability. Not every study has shown striking results, and the differences often come down to dosage, formulation, and individual response. But the consistent thread across both osteoarthritis and rheumatoid arthritis is that curcumin helps to quiet the inflammation that drives both conditions. For older adults weighing their options, this matters. Whether the challenge is the grinding pain of osteoarthritis or the unpredictable flares of rheumatoid arthritis, curcumin provides a safe, natural support that can be paired with conventional care. It does not promise a cure, but it offers the possibility of reclaiming movement, reducing stiffness, and lifting some of the daily burden arthritis places on body and spirit. And in the landscape of chronic disease, that kind of possibility can feel like hope itself. Here's the twist. Curcumin, as powerful as it is, doesn't easily slip into our bloodstream. It's like having a treasure locked in a chest with a rusty key. You may swallow a capsule, but only a small portion is absorbed and used by the body. Thankfully, nature provides a clever helper, black pepper. Inside it lies piperine, a compound that boosts curcumin's absorption by up to 2,000%, unlocking far more of its potential. Scientists are also experimenting with modern solutions like liposomal curcumin and nanoparticles, designed to make it easier for the body to use this golden healer. The question I hear most often is, does the science really back this up? The encouraging answer is yes, though with some caveats. A growing number of clinical trials and reviews show that curcumin reduces joint pain and improves mobility in people with osteoarthritis and rheumatoid arthritis. In fact, one review in the Journal of Clinical Rheumatology reported significant improvements in both pain and function compared with placebo. What makes curcumin stand out is that these benefits often come without the gastrointestinal side effects linked to common NSAIDs. Still, not every study is conclusive, and more long-term research is needed. When it comes to using curcumin, dosage matters. Most clinical studies suggest daily amounts between 500 and 2,000 milligrams, often divided into smaller doses. Because curcumin is fat-soluble, it's best taken with a meal that contains healthy fats, helping the body soak it up more effectively. Many high-quality supplements already combine curcumin with piperine to boost absorption. For most people, it's safe and well-tolerated, though some may experience mild digestive upset. Those with gallbladder disease or on blood thinners should be cautious. As always, the wisest step is to consult a trusted healthcare provider before beginning a supplement regimen. So, can turmeric cure arthritis? The honest truth is that it doesn't erase the disease, but it can ease the fire of inflammation, soften pain, and help protect precious mobility. For many older adults, curcumin offers a safe, natural companion to conventional care, restoring a sense of control over daily life. With smart choices, like pairing it with black pepper or choosing quality formulations, it can become a meaningful part of an arthritis management plan. I'm Dr. Brian, and I encourage you to like this video, subscribe to Wellness Blueprint Over 50, and share your own turmeric experiences below.